Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it.
So for today, we're going to start first by reviewing blood types and RH so that we can better understand this when we talk about RH incompatibility. So let's review. For RH is a protein that can be on the red blood cells. If this protein or the Rhesus factor D is on the red blood cells, it is considered RH positive. If this protein is not found on the red blood cells, then this is considered Rh negative. For today, we're going to look at it as letter D. So what about blood types? For the A blood type, we have a red blood cell that contains A antigens. If the red blood cell contains A antigens and does not contain the Rh factor, it is A negative. If the red blood cell has A antigens but also contains the Rhd factor, then it is A positive. For B blood type, we have the similar scenario except that this is with a B antigen. So if you have B antigens and no Rh factor, the baby or the patient is B negative. If you have the B antigen and you have the Rh factor, then they are B positive. For AB, same scenario, but now we have A antigens and we have B antigens for AB blood type. So both antigens are on the red blood cell. If there is not the Rh factor, it's Rh negative. And then if you have A antigens, B antigens, and the Rh factor, they are AB positive. For O blood types, the red blood cell does not contain either an A antigen or a B antigen. And so for an O negative, we have no A antigen, we have no B antigen, and we don't have the Rh factor. If we have the Rh factor, then we're O positive. We still don't have any antigens. Not A, not B. So how this works for Rh incompatibility. If the mom is Rh negative, she can be A negative, so she has an A antigen and no Rh factor. She could be B negative, have the B antigen and no Rh factor. She could be AB negative, have both the A and B antigen and no Rh factor, or she could be O negative with no antigen and no Rh factor. This is when this is affected, is if mom is Rh negative and the baby is Rh positive. So the baby can be A with an Rh factor, B with an Rh factor, AB with an Rh factor, or O with an Rh factor. So you can see when you look at it lined up like this, you can see the difference. Well, mom's body notices the difference as well. So if perhaps mom's body sees the baby's blood type, which can happen most often during childbirth if it happens, but sometimes with trauma and things like that as well, the mom's body looks at that D factor as foreign and can build antibodies. So if the mom is Rh negative, like we just looked at, and her red blood cells don't have the Rh factor, the baby's positive and does have the Rh factor, the mom's immune system can detect the positive Rh from the baby's blood as foreign and build antibodies. Typically, these antibodies are going to affect a future pregnancy because most often this happens when the baby's being born. So the antibodies aren't built up for this current pregnancy, but it can be built up for the next pregnancy. So what we will do for these moms is we will give them RhoGAM. RhoGAM will stop the production of the antibodies. So here is a picture from the RhoGAM.com website where we can see mom is negative, baby's positive. If the positive blood type is seen by mom's body, these antibodies can build up in her body and then attack the baby. Most often, as stated, this is going to affect a future pregnancy. So what we'll do is give RhoGAM. RhoGAM is going to prevent that immune response from happening. So then in the future pregnancy, if mom's body sees the Rh positive with the future baby, it's not already established antibodies that can be used against this current pregnancy and attack the baby. Because if mom's antibodies attack the baby's red blood cells and they get on the red blood cells, like in this picture up here, then it breaks down the baby's red blood cells, and this can happen at a very concerning rate, which can cause things like erythroblastosis fetalis. It might need an exchange transfusion for babies in utero. The anemia can be very severe, and then also significant jaundice because as those red blood cells break down, they're releasing bilirubin. So we give RhoGAM to all Rh negative mothers at 28 weeks gestation because we don't know if the baby is Rh positive or not. So we do this to from all moms at 28 weeks. We then, when the baby is born, we find out what the baby's blood type is. If the baby's blood type is indeed Rh positive, the mother will receive another dose of RhoGAM within 72 hours after delivery. If the baby's Rh is negative, there's nothing else to do. And then also Rh negative mothers who have an abortion, including a miscarriage or spontaneous abortion, or they have trauma during pregnancy, these moms also receive RhoGAM. For an abortion, we don't know if that baby was Rh positive. And then for trauma during pregnancy, we don't know at that point if the baby's Rh positive. And those are times that the mother's body could see that blood type. So let's practice this. A postpartum client's blood type is A negative, and her newborn infant's blood type is AB negative. The client received RhoGAM at 28 weeks and again in her third trimester after a minor car accident. The client is preparing for discharge and asks the nurse when will she receive her RhoGAM injection. The nurse correctly responds with which statement? A, you already received 2 doses of RhoGAM and you do not need an additional dose. B, I will give your last dose of RhoGAM today before you're discharged home. C, you and your baby have negative blood types. A dose of RhoGAM is not needed. And D, RhoGAM would have, would have been already given while you were in the delivery room. So let's think about our patient and our choices. Mom is A negative, baby is AB negative. Does mom need RhoGAM? Mom does not need RhoGAM because her baby is not Rh positive. So when we look at the choices, A, you already received 2 doses, so you don't need additional dose. That's not accurate. If her baby was Rh positive, she would still get an additional dose at delivery. B, I will give it to you before you're discharged home. We aren't going to give it to her. C, you and your baby have negative blood types. A dose of RhoGAM is not needed. That is the correct answer. And then D, RhoGAM would have already been given in the delivery room. It would not have. Remember that we give RhoGAM within 72 hours after delivery. So let's try another one. At 28 weeks gestation, an Rh negative woman receives RhoGAM. Which of the following would indicate that the medication is effective? A, the baby's Rh status changes to Rh negative. B, the mother produces no antibodies. C, the baby produces no Rh antibodies. And D, the mother's Rh status changes to positive. So when we think about the options for this question, what it wants to know, if we look at what it's actually asking us, is it wants to know how we know RhoGAM is effective. When we look at the choices, there are two choices that say that the RH status changes. RhoGAM does not cause an RH status to change. So we can eliminate those completely. Remember that RhoGAM's job is to prevent the production of antibodies. So now let's look at the other two choices. The mother produces no antibodies or the baby produces no RH antibodies. Who produces antibodies? The concern is with the mother producing antibodies that would affect a future pregnancy. So the correct answer here is B. The mother produces no antibodies. Which infant is at the highest risk of being affected by RH incompatibility? The mother is Rh negative and the father is Rh positive. The mother is Rh negative and the father is Rh negative. The mother is Rh positive and the father is Rh negative. Or the mother is Rh positive and the father is Rh positive. So this asks us about which infant is at the highest risk, but it doesn't tell us the infant's blood type. So we need to think about what the question is asking. The question wants to know which baby is going to be affected or has the highest risk of being affected by Rh incompatibility. So we know that this happens only if the mom is Rh negative. So we can eliminate the ones that state the mother's positive. So C and D are not correct. So how are we going to have the possibility of producing an infant that's Rh positive? If we have a mother who's negative and a father who's negative, their baby is going to be Rh negative. But if we have a mother who's Rh negative and a father who's Rh positive, we have a possibility of producing a baby that is Rh positive. And so this is going to be the infant that is the highest risk of being affected by Rh incompatibility because this is the baby that could potentially have an Rh positive blood type. So the correct answer for this is A. In the 12th week of gestation, a client experiences a spontaneous abortion. Because the client is Rh negative, the nurse must administer RhoGAM within 72 hours, make certain she receives RhoGAM at her first clinic visit, not give RhoGAM since it's not used with the birth of a stillborn, or make certain the client does not receive RhoGAM since the gestation only lasted 12 weeks. So remember that if we have a spontaneous abortion, we don't know if that fetus was Rh positive or Rh negative. Also remember that RhoGAM is effective if we give it within 72 hours. So the choices that say we don't need to give RhoGAM are not accurate. The choice between A and B, giving it within 72 hours or giving it the next time she comes to the clinic, we don't know when her next appointment is to the clinic. Her RhoGAM needs to be given within 72 hours. Therefore, A is the correct answer. Final question. A woman is Rh negative and pregnant. Her previous baby was Rh positive. The nurse would be correct in telling her which of the following information. You will receive RhoGAM 4 days after delivery. You do not need RhoGAM because your previous baby was Rh positive. You will receive RhoGAM at 28 weeks of pregnancy, or your partner is at risk as well as the baby. So for this question, it wants to know what is the correct statement related to RhoGAM for this patient who is Rh negative and has had an Rh positive baby before. A, receiving RhoGAM 4 days after delivery is not correct. Remember on the previous question, we reviewed that RhoGAM needs to be given within 72 hours after delivery. B, you do not need RhoGAM because your previous baby was Rh positive. Absolutely not true. Okay, if her baby was Rh positive, she should have received RhoGAM last time because her baby was positive, and then she's going to get RhoGAM at 28 weeks, which is option C. Every Rh negative mom should receive RhoGAM at 28 weeks of pregnancy. Remember, we don't know if this fetus is Rh positive or Rh negative, so all moms receive RhoGAM at this point. For the option D, so let's just look, that's the answer. C, you'll receive RhoGAM at 28 weeks. But let's look at option D. Your partner is at risk as well as your baby. The only person at risk here is the baby, okay? The partner doesn't have any risk in this. And the mother's only thing that happens to her is she builds antibodies. It doesn't harm her. The risk happens to the baby because, again, if the mom's antibodies get on the baby's red blood cells, it destroys the red blood cells and causes significant anemia, hyperbilirubinemia, and jaundice. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.